Pancreatic cancer is a serious and often deadly form of cancer that affects the pancreas, an organ located behind the stomach. The pancreas plays a crucial role in digestion and blood sugar regulation, producing enzymes that break down food and hormones like insulin. Unfortunately, pancreatic cancer is often diagnosed at a late stage, making it difficult to treat effectively. In fact, the 5-year survival rate for pancreatic cancer is only around 10%, making it one of the deadliest forms of cancer. That's why it's crucial to be aware of the warning signs and symptoms of this disease. This video will discuss 10 common warning signs of pancreatic cancer that you should never ignore. By being informed and vigilant, you can increase your chances of early detection and successful treatment. Remember, knowledge is power when it comes to your health. Sign 1. Dark urine. One of the first warning signs of pancreatic cancer is dark urine. The pancreas is connected to the liver and gallbladder through a series of ducts that transport digestive enzymes and bile. When the pancreas is not functioning properly due to cancer, it can cause a buildup of bilirubin in the blood. Bilirubin is a yellow pigment that is produced when red blood cells break down. Normally, the liver processes bilirubin and excretes it from the body through the digestive system. However, when the pancreas is affected by cancer, it can block the bile ducts, preventing bilirubin from being properly excreted. As a result, bilirubin can accumulate in the blood and cause the urine to appear dark or tea-colored. The medical term for this condition is coluria. Please remember that other factors, such as dehydration or certain medications, can also cause dark urine. However, if you notice that your urine is consistently dark and you have other symptoms of pancreatic cancer, please consult with your healthcare provider to determine the underlying cause. Sign 2. Oily stool that floats. Another warning sign of pancreatic cancer is oily stool that floats. The pancreas produces enzymes that help break down fats, proteins, and carbohydrates in the digestive system. When the pancreas is not functioning properly due to cancer, it can cause malabsorption of nutrients, particularly fats. As a result, the stool may appear greasy or oily and may float on the surface of the toilet water. This is because the undigested fats are lighter than water and tend to rise to the top. The medical term for this condition is steatorrhea. In addition to being oily and floating, the stool may also be pale in color and have a particularly foul odor. This is because undigested fats can also cause an overgrowth of bacteria in the digestive tract, leading to foul-smelling stools. If you notice changes in your stool consistency or appearance that persist for more than a few days, it's important to bring this to the attention of your healthcare provider. Sign 3. Jaundice. Jaundice is another common warning sign of pancreatic cancer. Jaundice occurs when there is a buildup of bilirubin in the blood, causing the skin and whites of the eyes to appear yellow. As we mentioned earlier, bilirubin is a yellow pigment that is produced when red blood cells break down. When the pancreas is affected by cancer, it can block the bile ducts, preventing bilirubin from being properly excreted. As a result, bilirubin can accumulate in the blood and cause jaundice. The medical term for this condition is hyperbilirubinemia. Jaundice is often one of the first visible signs of pancreatic cancer and should never be ignored. Sign 4. Itchy skin. In addition to jaundice, pancreatic cancer can also cause itchy skin. When bilirubin builds up in the blood, it can cause the skin to become itchy and irritated. This itching may be particularly noticeable on the hands and feet, but can occur anywhere on the body. The medical term for this condition is pruritus. The itching may be mild initially, but can become more severe as the cancer progresses. Sometimes, the itching may be so severe that it interferes with sleep and daily activities. If you experience persistent itching that does not respond to over-the-counter treatments, such as moisturizers or anti-itch creams, it's important to bring this to the attention of your healthcare provider. Sign 5. Blood clots. Pancreatic cancer can also increase the risk of blood clots. Cancer cells can release substances that make the blood more likely to clot. a condition known as hypercoagulability. Blood clots can form in the legs, deep vein thrombosis, or lungs, pulmonary embolism, and can be life-threatening if not treated promptly. Symptoms of blood clots include pain, swelling, and redness in the affected area. A blood clot in the lungs can cause chest pain, shortness of breath, and coughing up blood. If you experience symptoms of a blood clot, seek medical attention immediately. It's important to note that not everyone with pancreatic cancer will develop blood clots, and not everyone with blood clots has pancreatic cancer. Sign 6. Swollen gallbladder. Pancreatic cancer can also cause the gallbladder to become swollen and enlarged. The gallbladder is a small organ located near the pancreas that stores bile produced by the liver. When the pancreas is affected by cancer, it can block the bile ducts, causing bile to build up in the gallbladder. As a result, the gallbladder can become swollen and tender to the touch. The medical term for this condition is cholecystitis. A swollen gallbladder may also cause abdominal pain, particularly in the upper right part of the abdomen. The pain may be severe and may radiate to the back or right shoulder. Other symptoms of a swollen gallbladder may include nausea, vomiting, and fever. If you experience symptoms of a swollen gallbladder, it's important to seek medical attention promptly. Your healthcare provider may recommend imaging studies, such as an ultrasound or CT scan, to visualize the gallbladder and determine the underlying cause of your symptoms. Sign 7. Sudden and unintentional weight loss. When the pancreas is not functioning properly, it can cause malabsorption of nutrients, leading to weight loss. Further, cancer cells require a lot of energy to grow and spread, which can cause the body to burn calories at a faster rate. As a result, individuals with pancreatic cancer may experience rapid and unintentional weight loss, even if they are eating their normal amount of food. The amount of weight loss can vary, but it is typically more than 5% of body weight within a 6 to 12-month period. For example, a person who weighs 150 pounds may lose more than 7.5 pounds without trying. Other factors such as stress, thyroid disorders, or other types of cancer can also cause unintentional weight loss. However, if you experience unexplained weight loss along with other symptoms of pancreatic cancer, it's important to consult with your healthcare provider. Sign 8. Loss of appetite. Pancreatic cancer can also cause a loss of appetite. As the cancer grows and spreads, it can put pressure on the stomach and other digestive organs, causing a feeling of fullness. Also, cancer cells can release substances that affect the body's metabolism and appetite-regulating hormones, such as ghrelin and leptin. As a result, individuals with pancreatic cancer may experience a decreased desire to eat, even if they haven't eaten for several hours. They may also feel full after eating only a small amount of food. The loss of appetite can lead to unintentional weight loss and malnutrition, which can further weaken the body and make it harder to fight cancer. Sign 9. Nausea and vomiting. Nausea and vomiting are other common warning signs of pancreatic cancer. As the cancer grows and spreads, it can put pressure on the stomach and other digestive organs, causing a feeling of nausea or the urge to vomit. Further, cancer cells can release substances that irritate the lining of the digestive tract, leading to inflammation and discomfort. Nausea and vomiting can also be side effects of cancer treatments, such as chemotherapy or radiation therapy. The severity of nausea and vomiting can vary from person to person and may be influenced by factors such as the stage of the cancer and the individual's overall health. In some cases, nausea and vomiting may be mild and intermittent, while in others, they may be severe and persistent. If you experience nausea or vomiting that doesn't improve with over-the-counter treatments, such as ginger or peppermint tea, it's important to seek medical attention promptly. Sign 10. Abdominal and back pain. Finally, pancreatic cancer can cause abdominal and back pain. As the cancer grows and spreads, it can put pressure on nearby organs and nerves, causing pain and discomfort. The pain may be felt in the upper abdomen, particularly in the area above the belly button and below the breastbone. It may also radiate to the back, particularly the upper or middle back. The pain may be described as a dull ache or a sharp stabbing sensation. It may be intermittent or constant and may worsen over time as the cancer progresses. The pain may be particularly noticeable after eating, as the pancreas is involved in digestion. When the pancreas is not functioning properly, it can cause digestive enzymes to build up and irritate the lining of the digestive tract, leading to pain and discomfort. Other digestive symptoms, such as bloating, gas, or changes in bowel habits, may also accompany the pain. If you experience persistent abdominal or back pain that doesn't improve with over-the-counter pain relievers, it's important to consult with your healthcare provider. In conclusion, pancreatic cancer is a serious disease that can cause a range of symptoms and warning signs. By being aware of these signs and seeking medical attention promptly, you can increase your chances of early detection and successful treatment. The 10 warning signs discussed in this video are all potential indicators of pancreatic cancer. However, it's crucial to note that other conditions, such as gallstones, pancreatitis, or liver disease, can also cause these symptoms. That's why it's important to consult with a healthcare provider if you experience any of these symptoms, particularly if they are severe or persistent. Your healthcare provider can perform a physical exam and recommend tests, such as blood work or imaging studies, to determine the underlying cause of your symptoms and develop an appropriate treatment plan. Remember, early detection is key to improving outcomes for pancreatic cancer. By staying informed and proactive about your health, you can help protect yourself and your loved ones from this devastating disease. Thank you for watching, and don't hesitate to share this important information with others.